Thinking about LASIK surgery, but are afraid of any lasers or any machine touching your eye? How painful will it be? Let me explain the whole process of the LASIK surgery, how safe it is for you, whether you should be scared or not, and how good it'll be for you and a life-changing experience. Only facts and what works for you is what we'll talk about. And I'll tell you what exactly it'll make a difference to you and what are the wrong myths that people have in their mind. This is Dr. Himanshu Mehta, ophthalmologist at the Vision Eye Center, Juhu, Leelawati Hospital and Nanavati Hospital. We've been in practice for the last 35 years. I've been leading surgery from the day it started and it got US FDA approval in 1994. To begin with, what is LASIK surgery and what it stands for? The full form of LASIK is laser assisted in situ keratomileusis, and the full form of laser is light amplification and stimulated emission of radiation. Don't worry about such big names. What is more important to you is the only way scientifically proven to get rid of your glasses besides walking on green grass, and a proven surgical way which is safe, reliable, efficient and long-term stable, which has been proved by multiple studies. We'll get and dwell into the details of LASIK surgery as we move on further. How safe it is to get rid of your glasses and your dependence on contact lenses and to see the world clearly. A lot of people who want LASIK surgery delay it over the years because of lack of time and never getting the right consultation. My sincere advice to people who want LASIK surgery is do your homework, do your research, find out everything about you need to know about it. In your hospital, in your corporate structure, in your environment, in your building, find out patients who have got it done. Talk to them. So what I mean to say is don't talk to people who have not undergone this surgery. Without holding a bat, a lot of people say Sachin Tendulkar ne shot barobar nahi mara. So they don't even know what they are saying. So talk to patients who have done this surgery and talk to surgeons who do this. Don't ask somebody else. You don't ask me about a bypass surgery. You don't ask me about a knee transplant. Ask me about ophthalmology. And even in ophthalmology, few people do LASIK surgery. So talk to doctors who do LASIK surgery and talk to patients who have got it done. They are your best friends who will guide you what will be the right thing for you. Now let's talk about who's eligible and who's not eligible for LASIK surgery. Who's eligible for LASIK? Anybody who is about 18 and the number has been stable for the past 1 year. If your cornea topography is done and if your corneal thickness is good, you are eligible to do LASIK surgery. But most important is your willingness, your understanding and your inner desire that you want to do it. Anywhere where you are dependent on glasses is the place where you need to do LASIK surgery. Who are not eligible for LASIK surgery? Those who are extremely scared, are skeptical and don't want to remove their doubts. Medical condition, if you have keratoconus, or if you have pellucid marginal degeneration, or if your cornea is thin, then you are not a good candidate for LASIK surgery. Some myths and facts about LASIK surgery. The biggest myth people have is, it'll be painful. No, it is not painful. And do you want to hear this exactly? If you have -5 number, the amount of time the laser works on your eye is just 10 seconds and maybe less. Now see how fast it is. There is no injection. There is no pain which you will experience. You will be enjoying it's like a 007 thriller movie. Will I start seeing instantly after LASIK surgery? Of course, you walk out, but you will not be having clear vision. Your vision clears in the next few days. What is the downtime? With LASIK surgery, hardly 24-48 hours. We are almost back to work within a very short period of time. Is there any great recovery problem? Not really. You have to be careful. You have had undergone LASIK surgery. You better be careful and be safe. Will I lose my eyes? Well, till today it has been clear that the chances of you losing your eyes with a vehicular accident on the road and or with glasses is maybe more than you losing eyes with LASIK surgery. It's almost an impossibility. Less than 0.1% chance that something can go wrong with LASIK surgery. Can I get a number again? This is the $1 million question everybody asks me. Let's make it clear. Even if you don't do LASIK surgery at 20, 21, 22, 23, 24, you use a lot of computers, you misuse your eyes. Can your numbers change? Yeah, sure, it can change. So LASIK does not change your genetic composition. It corrects your number as of today. However, intellectual news that I'll give you and an important fact is that most often than not after 1920, your numbers do not change. So there is a very, very small possibility that you may get a small number. So feel free, get it done. It's almost there permanently for you. Now let's talk about various types of LASIK surgery. As I said, LASIK is laser assisted in situ keratomileusis, as discussed. So LASIK used to be performed with a microkeratome blade. Then a refinement came with the femtosecond laser. that we create a flap. Its femtosecond is 10 raised to minus 15 second. That's how safe and beautiful it is. And the whole LASIK procedure is done by the excimer laser, excited dimer 193 nanometer laser. But more important today, what has come up is custom LASIK, and that is Contura Vision femtosecond laser assisted LASIK. That is the latest and the best in the world. One size shirt does not fit everyone. So in Contura Vision, your topography of the eye is taken, fed into the computer, and the laser works accordingly or differently on each eye to give you even better vision and correct your numbers. The commonest question asked is, how fast is the recovery after LASIK surgery? What is the downtime? There is no injection given. There is no putty given on your eye. You walk out with open eyes. You go home, and that's how fast vision starts coming back again. But the most important question people ask me is the cost. Why is this expensive someplace, and what about the whole thing? There are modern generation laser machines which have come up. Newer technologies have come on. Newer software has come up. But let me give you some basic examples, sir. This phone of yours, you have to change every 1 to 2 years. It is not permanent. And yet this costs you more than what your LASIK surgery. And by the day, whatever you spend on yourself for LASIK, you can buy an Apple company also to get your clear vision. But people are more worried about spending money on their eyes because they were given free, and they are willing to stand in a queue to buy their iPhone. So make your priorities clear. Is your eye more important? Is your iPhone more important? Don't even think about cost. This is once in a lifetime that your eyes are going to ask for servicing. Take care of them. Your eyes were given free, but taking care of them is your responsibility. If what I talked about LASIK makes sense to you and you understand, do pass it on to your friends who are ignorant and or scared and don't have correct information about LASIK surgery. Do share, comment, criticize. And if you have questions to ask, feel free to ask me. I'll reply to them personally. This is Dr. Himanshu Mehta, Vision Eye Center, Mumbai, signing off for now.